Iowa nurses are on the front lines of fighting coronavirus every day. Tonight, we want to highlight one of them. Jamie Breyer is from Norwalk. She's a single mom who works as a nurse at Unity Point in the Metro. Jamie, thanks for joining us tonight.
Yeah, hi.
Hi. You know, one of your neighbors contacted us about your work during the pandemic. So many people are so thankful for their frontline healthcare workers. What has it been like here in Central Iowa?
Well, right now it's actually pretty slow. So I actually got hired back onto the hospital 1 week prior to all the COVID and the lockdown quarantine. So that was interesting. And then the hospitals have been pretty slow. We're basically admitting the patients who desperately need to be admitted and need to be seen. I think patients and families are being very diligent about coming to the hospital. So that helps a lot. So it hasn't been too crazy yet. We're thinking maybe it's the calm before the storm.
Right. Well, hopefully the storm isn't too bad when it comes, and we know that you are dealing with the most serious cases. In terms of what you're having to do for a patient and all the hoops you have to jump through, all the protective gear you have to wear, how has that changed?
Yeah, so it definitely, with the inpatient setting, you definitely have to think about what you're doing before you go into each patient room, because once you're in there, you can't leave unless you're undonning, basically taking off every single piece of equipment and PPE. So it's definitely making sure that you have everything you need and doing everything possible at one time, so you're not making multiple and then exposing other people multiple times from taking on and off your equipment.
Right. We know it's not like New York City here in Iowa. We've been impacted to much less degree. Do you feel like you have the equipment that you need? Do you feel like you can do this safely?
Yeah, I think so for now that we do. There's a shortage there for a while, I think mainly because people were panicking and going out and buying things and kind of hoarding supplies. But I think right now we have that all kind of something that has done really well with getting things stocked and people are ready for, there's like levels they're doing right now. So once we hit a different tier with more people, then everything kind of changes and we have people float to different departments. So I really think that they're doing a great job. I feel safe. I feel like I'm being taken care of properly and I'm able to, perform my job safely.
And is it comparable to your normal level of things that you're exposed to as a nurse? We know nurses see a lot of crazy things that a lot of typical people couldn't handle. Is this any different, or is it just a little more complicated?
At first, I think it was a little more complicated just because of all the unknowns. But I think the more that we're learning, I feel like it's just another part of healthcare. I mean, yeah, it's just something new every year. It's epidemics all the time. So I just think it just.
Is there an emotional toll to the COVID-19, or is it compared to what you see on a daily basis? Is it comparable to that?
I think it's seeing all the places right now that are getting hit really hard. I don't think here in Iowa, I personally have not gotten to that emotional state. So I've worked in the intensive cares and ERs before, so I'm kind of used to the high intensity. So I don't think I'm there yet. However, it is hard to see other states, other countries, other people suffering. So I definitely understand, but I think personally I haven't been too emotionally affected by it.
All right. Well, we appreciate you being out on the front lines and doing what it takes to keep Iowans safe. And I know you know that Iowans really appreciate the work that you and your colleagues are putting in every day. Jamie Breyer from Norwalk, thanks so much for joining us.
Yeah, thank you.